it's Rome, and welcome to another exciting, informative episode of Homefront. If you didn't know, well, now you know. This is the best show on TV. This is the best show on TV, hands down, because of guests like the one that I have with me here today. Today we are joined by one of our seasoned veteran guests from season 1. We had to bring her back into season 2, Dr. Paula Robertson. Thank you very much for joining us.
Hi, Rome. A seasoned guest.
Yes, a seasoned guest. And she is the pediatric specialist on Homefront, and she also does our mindfulness moment. So let's start with that, because you're part of a group called Mindful Kites?
It is Mindful Kites, yeah.
Mindful Kites. So what is Mindful Kites?
Oh, okay. Thanks for letting me talk about it. So we're actually a group that got formed together as a non-profit organization in 2019. So it's a mix of pediatricians, adolescent specialists, Dr. Pemberton, who's been on the program.
Right.
A couple of teachers, Kayla, who has done your mindful moments last time, and a school psychologist at the start. And we were really interested in helping young people develop healthy mental habits. In the same way as we work out our bodies, the concept of working out your minds and actually getting our minds stronger in terms of looking after our thought patterns and self-care, for example.
So mindfulness itself, we have been having these mindfulness moments from season 1 into season 2, and some people see me in the road and they say, "Oh, what is this mindfulness thing? That is what a kumbaya session all they have." And what is it really?
I love it, kumbaya. But so no less of the kumbaya. The best definition actually is really, it's about being fully present in this moment, here and now. So when I talk about it with young people, I usually say, well, often during our daily lives, we're not really fully here. We might be living in the past mentally, for instance, thinking about what happened, or worrying about or stressing over, going over an argument that we had and maybe should have said something differently. Or we're worried or thinking about what might or may not happen in the future. All right? And often we live our lives on autopilot. But this is about training ourselves to be actually completely and totally in this moment where life actually happens. And it is a learned skill, because it's a different way for us to think.
So it's about training your mind.
It is about training your mind, essentially.
Because I was reading a book recently, and in the book the author was talking about the things that we think about daily, and the author was saying that most of the time, the things that we would think about today, tomorrow when you wake up, you're going to think about almost the exact same things that you thought about yesterday, unless you start training your mind to think differently.
Exactly.
So if you're a negative thinking person, and yesterday you were so negative, chances are today you're going to come back and think those same negative thoughts that you had yesterday. So that's why I appreciate these mindfulness moments.
Well, I love that you brought that up, because often what happens is we're stuck on these loops, so we're stuck on repetitive patterns, and not just in the way we think, but the way that we react as well. You might notice that the same patterns keep happening over and over in your lives. So this is really about starting to take awareness and to create some space between who you are as a person and what is your thought at the moment, or what are your feelings, to start to give some language to feelings and emotions, and to find healthy ways to deal with that, because we're not really taught that in school.
Right. And talking about being taught in school, is mindfulness effective in children and in adults, or only is this a big people thing?
I like it. No, it's not like a big people party, no.
Right.
So no, there's some really interesting information and data on this now. A lot of the initial work with mindfulness was done with adults, and so most of the initial data has been based on adult populations, but within recent years there's been an explosion of data in young people and children. And a number of countries have been incorporating it into their educational programs and their syllabuses at school.
Right.
Yeah, so I actually have just done a year-long teacher certification with US Mindful Schools, and I'm also doing a training program with Mindful Schools program in the UK, sorry, my apologies. But with that, we've been meeting teachers from Austria, from South Africa, from Asia, for instance, a number of countries now incorporating it into their national syllabuses. And the data that we have on teens and young adults and young children is that it has powerful effects on things like self-esteem, stress management, anxiety, and things like dealing with big emotions and feelings. I could think of no better time for us to talk about mindfulness as now with the pandemic and everything that's going on, because the data we have is that we're getting a lot of issues with anxiety and mental health issues.
Yeah, because, and as you mentioned that, I have seen it myself, where a lot of my generation and even Gen Z coming up, is that you're hearing this word anxiety all the time coming up. And to me, when I was growing up, nobody ever used to speak about anxiety. And maybe mindfulness could help. Do you think that we should have it in part of our school curriculum?
Yeah.
It comes naturally to us. Unstoppable energy. We use it to manifest a future. A future where energy takes new forms and is used in new ways for all of us. The new age of energy is here.
Maybe mindfulness could help. Do you think that we should have it in part of our school curriculum?
Yeah, so one of our big projects really as part of the Mindful Kites organization, with the Kite standing for knowing, inspiring, thinking, and educating or empowering students, is actually that we have been driving for having this incorporated as part of the national curriculum. So I'm really pleased that in 2020 we got approval from Ministry of Education to start to teach it, and we've been working with a number of secondary schools pre-COVID. Then we had to switch to online pretty quickly when the lockdown happened. So we dealt with a number of webinars, training programs, and so on that happened online. And I have just been finishing off working with a primary school for a year, about 120 kids between the ages of 8 and 11. And taking them up for another year again. And I know that Kaylin has been working with one of our orphanages as well. So we've been really trying to kind of get the message out there. And our idea is to try and develop a lot more video, soft material that we can perhaps get into schools now that they're online.
And in terms of religion, does mindfulness clash with religion in any way?
So the way I like to think about it, that's a good question. All religions, all major religions have some sort of contemplative practice. Right? And so there is that element of contemplation that it takes place in mindfulness, but it is at its core secular. It's not religious at all. There is no associated religion, and it's not about converting anyone. In fact, I got drawn to it because I'm really interested in brains and neuroscience, and that's where a lot of the data has come from. And what we know is that when we train our minds with mindfulness, they're parts of our brain that can grow and develop. Specifically, a little bit of neuroscience, a part of the brain called the prefrontal cortex. That's our higher center. That's the last to develop, but it's actually the part of the brain that's involved in things like developing intuition and higher thought and knowing a better direction to go in, planning, and so on.
Is that the part of the brain that the women have more than the men, that you all have a sixth sense of the man stepping out the relationship, or they just get tingling?
No, there's no proven sex difference in your prefrontal cortex. But what's interesting is that it's growing and developing up until age 25.
Right.
Yeah. So that actually is the last part of the brain really to mature and develop. Prior to that, we tend to live off of loops, off of things like our emotions or memories, and really just reacting rather than planning or really bringing intention into what we want to do next. But the good news is that we can teach young people to actually engage and develop their prefrontal cortex. And looking at functional MRI scans, they've shown that those parts of the brains can in fact grow and develop new pathways. So that's really exciting. So for me, mindfulness is really secular. It's about understanding the brain science. It's about learning about healthy mental practices.
And talking about healthy mental practices and the effects of mental health, in this pandemic, you being one of our pediatric specialists, what mental health effects have you seen so far in terms of the pediatric population?
Oh gosh, really, that's a good question. I mean, I think we have seen a real change in the type of patients that we've been seeing through the pediatric emergency department. We used to see a large number of respiratory illnesses, so asthma and so on, and we had a reduction of that during the lockdown, but an exponential increase in a lot of things like anxiety, a lot of self-harming, a lot of depression. Things like acting out, for instance, trying to maybe miss school sessions or not being able to access online schooling. It was a huge one. There's lots of social issues as well. I think we are definitely going to see a tsunami, not just here, but internationally, of a lot of mental health issues as we come out progressively out of lockdown.
Of the pandemic. And I'm going to put you on the spot a little bit here, because you spoke about all of the mental health issues in the pediatric population, and then we have a lot of cases in terms of COVID-19 now, and then we have the kids saying that they're kind of tired of being home and they're missing the socialization with their friends. So all of these things together, Do you think we should reopen these schools
Ah,
with all this considered?
So what I would love to see happening are more conversations with all parties involved to see how we can do this safely, because we know that school is not just about delivering a syllabus. It's actually about so much more. It's about socializing, a sense of identity. We talked about the brain growing and developing during these really important years. You know, during your teenage years in particular, it's about developing a sense of who you are and where you fit in. And school is a vital part of that. A lot of our young people have been saying they feel disconnected, they feel without a sense of purpose, for instance. I was looking at an interesting study this week that came out of Austria that showed that when they have integrated reopening of in-person schools safely, they found a significant reduction in depression and anxiety in teens. But what they did find is they needed a lot of psychological support to make that transition back in. So I think that we should be having conversations about how we can do this safely, whether that is phasing in, gradual opening, maybe looking at hybrid schools, for instance, meaning some perhaps online, some are in the classroom, how that could work and how we could support our teachers in delivering that, because that is a big ask. But we should be talking about how we can start to come out of this side, the other side of this, while getting our young people to get a life education.
All right.
Yeah.
In terms of pediatric care and pediatric issues, I know there are a lot of myths surrounding this. Where are some of the myths that you would hear? I heard about organic food as one. Is organic food really good for you?
Well, generally, what I would say is actually I think of food as a type of medicine. I need to tell people what you really want to do is have a good, well-balanced West Indian diet, all your ground provisions, all the colors of the rainbow, all of your lean meats and things like your fish and so on. They're actually really good for you. And they're your best sources of natural minerals and vitamins, right? And your body needs that. That's a general rule across the board. The idea of the organic movement is really about minimizing artificial or additional man-made components. So things like your preservatives or your pesticides and so on. You want to minimize exposure to that. Generally, what I would say is you want to try and do natural, man-made, reduce your man-made, your processed foods as much as possible. But you can balance a life without necessarily feeling it has to be all organic. Some foods, the ones where we tend to eat skins, that have thin skins, for instance, like say those who like grapes and berries and so on. I have a few kids who only like to eat very expensive strawberries. You do probably
want... fancy kids?
Yes, I do, and I laugh at those. And like, you need to eat some Trinidadian popo and things. But basically with those, because the skin of the fruit can get more absorption of pesticides, you want to be a little bit more careful and probably try and go organic with those. But fruits that you can peel, for instance, probably less of an issue for you to necessarily only hunt out the organics. Yeah?
Right.
Wash your skin, your fruits, well, that's the main thing I'd say.
We're going to talk a little bit more of some of those myths when it comes to the pediatric population and the kids as well. But right now, the topic of the day, mindfulness, as we head into our mindfulness moment on Homefront.
Hello and welcome to another mindful moment. Today I'm taking you through another breathing technique, and this one is called the 4-square breath. It's a really good one for people to help us focus our mental attention and clarity. And especially one of my favorites because whenever we are in this age of Zoom and looking at pictures of our friends or colleagues, it's useful to kind of trace around their picture on the screen. So the way that it works is as we draw an imaginary square with our fingertips, whenever we go up, we breathe in, and then we hold our breath as we go across, and breathe out as you come down, and hold your breath at the bottom. Okay, so it will go like this. Breathe in, and hold, and out, and hold. Good job. And breathe in again, and hold, and out, and hold. And so this can be one that you trace out in the palm of your hand, for instance, if you're remembering to breathe before taking a test or an exam. I like doing it, as I said, when we're on Zoom calls as well. So remembering to use your breath as a powerful tool to help you focus and to be here now.
It's Rome, and we are here. We're chilling with the boys. We're liming with the kids. We're doing this all for the PED CARES Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3.
Yeah!
Yay! The PED CARES Foundation. And that was our mindfulness moment by our very own Dr. Robertson. And thank you very much for doing all for the entire season, for season 2. Yeah, we enjoyed it. We definitely enjoyed it. So we're talking some of the myths in terms of pediatric care and pediatric issues that we would have with the kids, right? And my producer was telling me about an asthma myth. What is the asthma myth?
No, so I love my job, right? But one of the things I love is I learn something new every day, literally. So one of the things I learned, which I have to say I did not learn in medical school, and I did get this in pediatric emergency, was one of our cures for asthma is thought to be the use of something called lizard water. You ever heard of it?
Lizard water?
Yeah, so I have to say...
As in the water the lizard is drink, or the water the lizard is let go?
I'll tell you what it is. So basically, I have to say this is not medically conducive.
Please note.
When we are counseling parents about the things like, avoiding triggers, yeah, so basically you want to make sure nobody's smoking in the house, and that you're reducing maybe things like cat and dog hair exposure, allergens, and so on in the environment, using your inhaler wisely, and so on. I do sometimes ask, what else do the families do at home? And I did have a parent who told me that he does use lizard water. So I had to inquire, and he told me that what you do is you get one of the house lizards that are usually found behind paintings. They have to be found behind a painting. And you grab one of them, and you hold them over a pot of boiling water and basically drop the lizard into this water, essentially. And it then swims around. What I'm not sure about, right, is how long the lizard has to be in the water, because I did ask, but I didn't get an answer for this. But then you drink the water, essentially, and that's supposed to reduce your asthma exacerbation. So I have to say that there is no medical evidence that this works. But
Shanice has come up with some of the weirdest remedies I have ever heard of in my life. I think this had to be one of them.
I would definitely not recommend lizard water, but I have since heard that there are quite a few people who have heard of this. Yeah.
Well, I have red lizard home by me making plenty noise when the night comes, so I come and take them and you can get the water.
Please do. These are real. But yeah, I mean, it actually sparked a lot of interesting conversations. We were talking about other things, and I had a friend of mine who also is in the medical profession, and her mother used to believe that if she had to stand in front of a pawpaw tree, but a nail in the tree just above her head, right? And as she grew past this nail, she would grow out of her asthma. I have to say, again, no medical data for this, but it is true that generally speaking, a lot of children and young babies in particular grow out of that tendency for wheeziness, so it becomes less and less severe and frequent as they get older.
Right. But it had nothing to do with the nail in the pawpaw tree. All right. What about use of milk when a child has a cold?
Yeah, so this is a good one. I mean, I'd say things are pretty split down the middle with where this is concerned. So for some people, they find that if they do drink or consume milk products, they tend to get a lot more mucousy. And I'd say if that happens for you, if you've noticed that for your child, whenever they drink milk, they tend to get a bit more phlegmy and mucousy, then it would be reasonable to temporarily reduce your milk intake until your cold symptoms have settled. If it really doesn't make that much of a difference, what's more important is actually good nutrition to help you get through your illness. So
because I know even for singers too, they always advise us not to drink milk because it causes mucus.
So I know that for some people it definitely have that effect, and I think you have to know your own body. Yeah, probably the only time we might advise you not to temporarily come off of cow's milk is actually after you've had gastroenteritis. So if you've had that, and I'll explain why. So after gastro, your bowel actually wall is really a little inflamed and it doesn't absorb milk sugars particularly well. So while you're in that recovery phase, we usually tell parents temporarily omit cow's milk. You might want to switch over to cow's milk free formula, like maybe soya based, for instance. That's temporary until your stools are back to normal.
No, but then too, in terms of the use of milk generally, I heard people saying that it's not good for adults. Is it good for children? Up to what age?
Right, yeah. That's
Because we heard when we were a child, drink your milk for strong bones and teeth. But then we become an adult and they're saying, don't drink any milk because we can't digest it or something like that. And I'm like, hello, all the confusing
a
milk.
whole program for this one. So I would definitely say, by and large, your best milk is human. Right? It's basically breast milk.
Oh,
human
I want to know
milk until you are 6
milk
months. Of course, we're human milk.
Right.
So breastfeeding babies until they're 6 months. That is designed for them. They're easiest to digest. It helps with their gut bacteria. It helps to protect against disease and illness. And it actually helps to protect you against obesity later on, right? After that, you want to wean on to, as I said, a good West Indian diet. And you don't need to have a lot of additional milk as part of that. And I see people spend a lot of money on follow-on formulas and so on. Actually, in a good West Indian diet, that's not really necessary. A lot of the studies are based on US toddlers, and their diet is pretty restricted compared to ours. So give them good West Indian food, and you can get your dairy from other sources as well, like yogurts and cheese and so on. So I don't intend to push a lot of milk past 6 months.
And quickly before we wrap up, in terms of parents panicking if a child gets a fever, how should they panic? Is this a normal thing?
All right, so I love this question because what I usually say is fever is not a bad thing. You got to remember what fever is there for. Fever is actually a sign that our body's mobilizing the defense army. When our temperature goes up, our white cells move more effectively, and that helps us fight bacteria or invading viruses. So it's actually a normal, healthy immune response. I think because we've been locked down and people have sort of been having their kids at home, we've kind of forgotten what managing a fever is like. So really supportive, just lots of cool fluids, have your Panadol ready. I usually have a little fan on in the room to get air to circulate, not the AC. But we definitely say to speak to your pediatrician if the fever is not settling with things like Panadol, if they're not keeping any fluids down, and certainly if it's going on for more than 5 days, because sometimes what can happen is you can get a secondary bacterial infection, like say a tonsillitis or an ear infection.
Right,
so we just want to check, let's make sure that nothing like that's happening.
Okay.
Yeah.
So thank you very much for joining us, Dr. Robertson. As usual, it was a pleasure. On my end as well. This has been Homefront. My name is Rome. We're here at the Dwellings, so thank you very much to our friends at Dwellings and to our PED CARES Foundation. Make sure you go to the website and you donate as we do it for the kids. And that was a... There you go again. Yeah.